All right, so let's talk about past medical history. So when we have to take past medical history, there are a few questions that we need to ask. First of all, we'll be asking a previous similar episode. For example, patient has come to us with chest pain. So we definitely need to ask, has it ever happened before? So that will be very important. For example, patient had angina before. So we'll be asking the patient what kind of treatment you got, and accordingly we'll be able to make the diagnosis this time as well. It will be very, very easy for us. So previous similar episodes, very, very important in case of past medical history. Has this happened before? If yes, how many times, and how was it managed? What kind of treatment, what kind of management was given to you? So that is very, very, very important. We need to ask about medical illness. It's very important. Have you ever been diagnosed with any medical condition, right? If yes, we will asking which medical condition, how long they have been diagnosed with that medical condition, how we are managing it, and if it is well controlled or not. For example, patient said, yes, I'm being diagnosed with diabetes. So we'll be asking about all these things. For how long, how you are managing it, are you checking it regularly, is it well controlled, do you have any symptoms of it? So we'll be asking lots of things regarding that particular medical illness. Moreover, when you ask this question, have you ever been diagnosed with any medical condition? Patient said no. So still it is always better you ask few things. You can ask about diabetes, hypertension, cholesterol, liver problem, any kidney problem. You can ask lots of questions depending on the station you are doing. For example, you are doing a station of say heart, you mean you are doing a station of chest pain, which is ACS. So we know diabetes, hypertension, cholesterol, all these are risk factors. So you can ask these questions. Have you been diagnosed with any medical condition? No, doctor. By any chance any diabetes, any high blood pressure, any high blood cholesterol? No, because indirectly you are telling it to the examiner as well that these are the risk factors that I need to rule out in this particular case. Right, so this is what we are going to do, but make sure always open question, because some of the time we see like candidates ask the question this way: have you ever been diagnosed with any medical condition like diabetes? See, you are opening the question at the same time you are closing it. In one sentence, when you say, have you ever been diagnosed with any medical condition? No, doctor. Now it's your time to ask about the medical condition you're looking for, like diabetes or high blood pressure, liver or kidney or any other problem. But if you ask in one go, have you ever been diagnosed with any medical problem like diabetes? No, in that case, the patient says no, he is saying no only and only for diabetes, not for other things. So we have to be really considerate on that particular thing. Do not make mistake there. Right, so this is very important in case of medical illness. We need to ask for medication as well. Are you on any medication? And make sure we are covering over-the-counter medication and herbal remedies as well, because many patients, if they are taking some for example painkillers over the counter, maybe ibuprofen, that is over the counter, it is available in the UK, so you can have it, and patient might not be thinking it is a medication that I need to tell it to the doctor because I'm taking it over the counter, it's not been prescribed to me. But it's very important for us to know. For example, patient is taking ibuprofen for such a long time, for maybe 2 years, and we know it can affect their stomach, it can affect their kidneys as well. So that's very important for us to know. So when you're asking about the medication, make sure you are involving OTC, over the counter medication, and herbal remedies, because many patients, they have got this misconception about the herbal medication, that they are the safest medications. What do you think? Are they safe? First of all, lots of herbal medication, we don't know what's the content, we don't know how it works, we don't know the mechanism of action, we don't know about the interaction. So how can we say they are safe or they are not safe? So what we need to do, we need to ask the patient, are you on any medication, including over the counter and herbal remedies? If they say yes, we need to go in detail, which one, since when you are taking them, and do you take them regularly or not, regarding those medications. So everything is very important when we are asking about the medication. Then comes allergy. That's also a very important question. Do you have any allergy to any kind of medication or food? That's very important. See, patient might be having allergy to penicillin, and you are dealing with a case of infection, and you are going to give antibiotics. So it is very important for us to know if patient is allergic to anything, if patient is allergic to any food. That's very important. And for example, you have got a case of allergies only, like you might have got a case of urticaria, you might have got a case of asthma, right, anaphylaxis. So in those kind of things, you need to know and you need to go in detail of allergies. For example, it's an asthma, so we need to know like if exercise is making it worse, carpets, pest, if it is seasonal asthma, if it is because of anything, maybe because of dust, right? So that's very important. Maybe peanut allergy if you're thinking about any food. So everything is very, very important. In the UK, you will see lots of patients, they're allergic to penicillin. I don't know the reason, but they are. So if you need to prescribe antibiotics, you have to be very, very careful. And please do not miss this point. If you're going to miss this point, it's going to be very much like devastating for us. It's going to affect our marking very badly, because if you're giving penicillin to someone who is allergic to penicillin, that is a big blunder. So be very, very, very careful. Hospitalization, it's very important. Have you ever been hospitalized previously? So that's very important. If patient says yes, why, when was it, how was it managed? So you need to go in detail. I mean, whatever positive point you get, you make sure you go in detail. Why you were hospitalized, when was it, what was the problem, and how did they manage it, and what was your experience, how was it experience in the hospital? Because maybe patient, we are admitting the patient this time also because of the same problem, and patient might say, doctor, when you admitted me last time, I had bad pain, I had very severe vomiting and all. So that's the thing we have to be very careful with. So if patient has got concern that time regarding those pain and vomiting, so we'll tell the patient, don't worry, this time we'll be taking care of these things, right? So that's very important in past medical history. What else is important? Our surgery, like have you had any surgical procedure in the past? That's very important. If they say yes, what was the surgery, when was it, any complication, and how long were you in the hospital for? So you need to go in detail of that. If patient says yes, doctor, I had hernia surgery, okay, how was it, any complication, how long you will stay, how long did you stay in the hospital? So all these things are very important. How was your experience? Maybe they will say, no doctor, it wasn't a good experience. No doctor, it was a really nice experience, and I didn't face any of the complication after the surgery, and the surgical team, they took good care of me. So thank you so much for that. So that's something that you need to ask regarding the surgery in past medical history. And one more thing is family history. So in past medical history, family history is very important. We know like anyone in the family with any medical condition, it's very important question. Maybe like if a patient is coming to the hospital with chest pain and we are thinking it is ACS, so we know like if patient family has also got these kind of things like ACS in the family, diabetes in the family, hypertension in the family, so the person is also more prone to have those problems. If their father, if their mother, if they have got these problems. So if they say yes, I have got some medical condition in the family, which condition, when they were diagnosed, how was it managed? For example, a person is diagnosed with ACS now, so they have got family history. Father had a heart attack. So ask, at what age father got heart attack? Maybe 50. So at the age of 50, this patient is also prone to have heart attack, or maybe a bit before that, before 50. So we have to be very considerate, we have to be very careful, and we may start the patient on some prophylactic medications as well, like statin or aspirin, to make sure this patient, our patient, will not develop any of the thing like heart attack. So that's very, very important, right? So if we see in one slide, so past medical history, we have got previous similar episode, has it happened before, yes or no? If yes, make sure you go in detail. Medical illness, have you been diagnosed with any medical condition? Patient will be telling you yes or no. If it is yes, make sure you go in detail. Medication, are you taking any medication including over the counter and herbal medication? If yes, go in detail, why you are taking, for how long you are taking. Allergies, do you have got any allergy? Right, medicine allergy, maybe food allergy, environment, any allergy they might have. So make sure you go in detail. How did you get to know that you are allergic? When you were diagnosed with this allergy? What was your age? So you have to go in detail. Have you ever hospitalized before? If yes, ask in detail. Have you had any surgery previously? If yes, ask in detail. Family history, anyone in the family diagnosed with any medical condition? If they say yes, make sure you go in detail, because all these questions are very, very important for us to know, and it will be very helpful for you. For example, you're doing counseling, all these past medical history questions, they will be really, really helpful, because you can find lots of risk factors in past medical condition, right? So this is what you need to know in past medical history. Thank you.